sun blazed so brightly up in the summer sky. I shouted at the mountains, watch me shine and fly. But then cracked the thunder.
Upati graduation ceremony for cohort 3. A warm welcome to all the Upati friends, family, colleagues and supporters from across Europe and around the world. We're going to have a lovely small program for you tonight, celebrating the achievements of all of our graduates from cohort 3 of the Patient Expert Training course that Upati's been putting on from 2017 to 2018. Before we begin, I'd like to hand over to the EPF President, Marco Greco, for a few short words.
We are here today for celebrating a big achievement for you, that you have completed the third cohort of the Upati class, and even for Upati and EPF, that is a big supporter of this program. It is important for us that this class has been successfully finished, and we are fully aware of the difficulties that taking this class takes with it, and how long the program is and how difficult to fulfill all the tasks. So we are very proud of each one of you. You have done an amazing and an outstanding job. But now it's only the beginning of the challenge, because outside there is a lot of work to do, and we do really hope that the instruments and the skills that you have gained over this year will help you in making your job, your everyday job as patient advocate, a bit easier, and will allow you and us with you to achieve new important results for the patient community. You know, every year at the end of the course, I always look back retrospectively to my story, and if I think at the moment in which I've started being a patient advocate, it's now more than 25 years ago, if I try to understand what I was missing more, probably that is a new Upati course. It wasn't there, but it would have avoided me many mistakes, and it would have made my work much easier. I hope this will be the result for you, and let me, for this reason, ask you one final effort. From now on, you are a member of the alumni class and of Upati, and you are an Upati fellow. That means that when you will be outside working, advocating for patients, they will know that you have taken this class. And for us it's important. For us it's important that you will put in practice what you have learned, and that you will show to the outside world that it has a value to take this class, and it is important. Because that will allow us to raise more awareness on Upati, more resources, and in the end it will make possible to organize other classes in the future. If you, like me, believe in the importance of this course, in the importance of Upati for the patient community, that is an essential role that you are now called to play. So let me congratulate with you once again for this achievement, and for the next one that I'm sure you're gonna achieve in the next few years. Thank you.
Thank you, Marco, for those kind words. Tonight we get to celebrate the achievement of our 54 Upati fellows who've undertaken the Patient Expert Training course. For those of you who've not had that privilege yet, or have supported your loved ones and friends going through that course, let me lay that out for you. We've divided up the patient engagement pathway, the roadmap, over the end-to-end area of medicine's R&D, all the way from setting research priorities to the areas like health technology assessment, into 6 modules. Every student goes through the process of taking e-learning in each of these different modules, which are then combined with 2 face-to-face sessions that we had in Madrid, each of about 4 days, which are intense, which are hard work, but are also a lot of fun and a great way to meet everyone else from the Upati network and everyone else in cohort 3. Tonight, we get to celebrate the achievement of everyone who has completed this hard work. We couldn't do this without all of the hard work also of all the volunteers, and all of the UPATI partners, consortium members, and individuals to make such an event a success. Those who were active on the course committee, those who read and corrected and updated and created the new sessions through their work on the editorial board, and all of the people who've already previously worked on UPATI when it was an IMI project before it came under the house at EPF. My name's Matthew May. I'm the coordinator of the UPATI program, and I'm immensely proud to be able to announce the following people as UPATI Fellows tonight. First off, I would like to announce our first UPATI Fellow, previously UPATI trainee, Alba Diaz from FEDER Rare Diseases. Alba wants to empower people living with rare diseases to fairly represent their own interests regarding research, drug development, and access to diagnosis and treatment to enable them to foster research on relevant unmet needs. Congratulations, Alba. Jeanette Anderson from Lupus Europe is already applying her UPATI training through the Lupus Network, PAN, where they train lupus patients to take part in medical research. Jackie Brown, a thalassemia victim and others with disabilities, uses her learning from the UPATI in a range of activities from arthritis research, e-health records, patient engagement groups, and patient research surveys to become a member of the Irish Independent Monitoring Committee for the UN Convention on the Rights of People with Disabilities. Loris Brunetta from Thalassemia International Federation is a patient's representative on the Committee for Orphan Medicines Products, also known as COMP, for those of you now in the know through the UPATI calls, of the European Medicines Agency, and uses her UPATI training to exert her role in a more meaningful way. Johannes de Graaf from the Dutch Pituitary Foundation. During the training, he already experienced the benefit of knowing more in discussions taking place at the National MEB in the Netherlands on certain medicine problems. It makes such a difference being able to join those discussions and knowing and understanding what everyone else around the table is talking about to really get your own point across. Jared Eastwood from Fighting Blindness. Jared uses the knowledge and experience gained in the course to represent the vision impaired community wherever decisions are being made about their healthcare. Carrie Favank from Norwegian Melanoma Association hopes to use her training to make a difference for melanoma patients on a systems level. Sergei Fomik from Russian Association of Parents of Children with Achondroplasia hopes that he can use the knowledge he has gained to help his organization work more effectively and also to take part in clinical trials, moving into the more scientific areas that we've seen in the UPATI training. Rita Francesco from Congenital Disorders of Glycosylation wants to continue development of patient-centered research projects by leveraging her scientific background and close ties with academia, but also to collaborate more with regulatory and governmental agencies in the future. Maureen Georgia from the Georgian Harm Reduction Network. Maureen wants to translate some of the modules into Georgian, and we can't wait to see that happen. Hopefully, she'll also be able to find a group of volunteers to work to develop a small working group and establish educational centers for activists. Sabrina Grigolo from Behavioral Disorders would like to use her training to get more involved in the health technology assessment process. Nicole Gousset from SMA Schweiz, that's spinal muscular atrophy, will use her training to change the way she presents her point of view when advocating for patients with other stakeholders. Rob Hagen from Parkinson Vereinigen just finished 14 months of the UPATI patient expert training and is puzzled, as we can see in his picture here. But I hope he'll soon be pulling all of his pieces together and use the knowledge in his daily work. Delphine Hennen from Kick Cancer, a pediatric cancer organization, will use her UPATI training to significantly improve the survival and health outcomes of children with cancer by helping many other parents to gain a voice and become a true partner to clinicians and the industry. Ekaterina Kotomotskayane, I'm sorry for my pronunciation there, but I love your photo and that of your dog as well. It's from the Arthritis Foundation of Crete and will collaborate with fellow colleagues on a national level to educate and empower patients and to raise awareness about the need of strengthening the patient's voice so that it can be heard in the decision-making processes. Chris Cusildo from the Sanfilippo Syndrome and Rare Diseases wants to use his knowledge to be more efficient in finding a cure and treatment possibilities for rare diseases, in particular related to lysosomal storage diseases like MPS. Olsten Kladen from Tourette syndrome wants to use the Upati training that he's taken to become more involved in the health technology assessment processes and hopefully be included in central decision and buying processes in Norway. Max Lipner from Europa Oma, Switzerland, wants to leverage his training to be more included in hospital as a patient advocate regarding therapy change, trial concept, trial following, and ethics committees for trials. Isabel Manner from European Cancer Patient Coalition will use her Upati training in her daily work at ECPC to help cancer patients throughout Europe. Celia Marin from the Leukemia Patient Advocates Foundation wants to improve patient participation and access to actions and programs with other stakeholders. Rebecca Umbewe already uses her knowledge to inform and empower fellow patients on how they can get involved and make a meaningful change. Tamara Milgra from Evita Cancro hopes to get actively involved in research and development as well as HTA, which has already happened for her in some occasions with InfoMed. So well done there, Tamara, already getting involved in Portugal. Biljana Mirceska from Save Liver Slap, it's one of my favorite organization names, I have to say, wants to pass on her knowledge gained on the course to other patients and representatives, and also to start Upati Macedonia, and we cannot wait to work with you on that goal. Tony Montserrat from LMC Pacientes, that's the chronic myelogenous leukemia in Spain, will use his training to bring positive value to the patients that he represents, seeking the greatest benefit for patients, regulators and industry, where we must all get involved. Marzen Nelken from the Federation of Polish Patients wants to establish professional training for patients in Poland to share knowledge about clinical trials. Joanna Neves, now working at Boehringer Ingelheim, not at the time when she started the course, will pave the way in showing the world that Upati training will also help pharmaceutical employees become better professionals. After going through this experience as an advocate for patient participation in medicine's development and healthcare decision-making processes. So changing the world from the other side, so to speak, Joanna, we're really looking forward to working with you in your future role as well. And now I'd like to hand over to Nicola Bedlington, one of the co-chairs of the steering group of Upati, currently Secretary General of EPF, for a few short words.
Good evening. My name is Nicola Bedlington, the Secretary General of the European Patients Forum, and I'm delighted to join you this evening. I've had the honour and pleasure of being the co-leader of Upati over the last few years, together with Matthias Gottwald. And EPF, my organisation, has been really very privileged to invest in Upati as an IMI project, and then more recently as an EPF programme. I'm really proud to be part of that. Upati, we know the essence. It's all about quality education and materials, and Upati has come to have an incredible reputation for delivering on that, to enable patient leaders to have and offer their unique insights, experiential knowledge and expertise to really improve the medicine's development process. So we have Upati focusing very much on education. Unfortunately, there are two sister initiatives focusing very much on patient engagement, also very important. We have Paradigm, which is an IMI project, looking at a framework on patient engagement, looking at the metrics, looking at the tools to facilitate it and capacity building, but also a global initiative called the Patient-Focused Medicines Development Initiative, looking at patient engagement across the planet. And if you're interested in learning more about either of those initiatives, then please do contact EPF, because I think your insights and expertise in both areas will be really extremely valuable. I would like to thank you all for the investment of time and commitment that you've shown in UPATI by completing the course. I can only imagine the days, the nights, the weekends that you have put in so much effort and so much work alongside your other commitments, your family, your workspace, your patient community. So a great big thank you from me and from EPF for all of that. I'd also like to take the opportunity to thank very much all of the supporters and volunteers. I mean, UPATI is all about that in any case as a public-private partnership, but particularly linked to the course, the work that's gone into creating really dynamic face-to-face meetings, for example, through the input of the course committee, but also, as I say, the experts that came to the table to work with all of you to make it a really valuable an inspirational experience, but also lots of fun as well. As you sit here at this award ceremony, many of you may be asking yourselves, well, what happens next? And from where I'm sitting, I can see how much is happening on patient engagement that really requires your know-how and expertise. There are many very valuable strategies out there that EPF and others have helped to encourage within the pharmaceutical industry through FPIA, within the European Medicines Agency, and tremendous track record on patient engagement, really making it happen in the regulatory space. Within the Innovative Medicines Initiative itself, increasingly within the HTA environment, and also actually now more and more with MedTech. But none of this will happen. Patient engagement cannot be done properly, of course, without the expertise and knowledge of patient leaders like you. So I really hope that you will be able to use the knowledge that you've acquired during the UPATI course to really influence and create the change that's needed in the medicines development process, the life course of medicines. It would also be really great if you could continue to invest as you have in UPATI as a programme, so that we can together shape and craft the future of UPATI. We're really at an important crossroads, and so we can imagine that in 2025, 2030, there will be future award ceremonies like this one, and future patient leaders will also become UPATI fellows, increasing the community of experts out there, again, to really make sure that medicines benefit optimally patients at the end of the day. So big thank you for being here, for being part of UPATI, and I really, really hope that you enjoy the awards ceremony, and I wish you all the very, very best for the future. Thank you very much.
Thank you very much, Nicola. Coming back now, before we begin to go through the other fellows, I'd just like to highlight to all of you the opportunities that exist within the UPATI network. And obviously, we have people who come back and help with future runnings of the course, who become active at a national level via the UPATI national platforms. And I know a number of you have already been working with those that exist in your countries, or have also reached out to me and Gemma Keelan, our UPATI National Platforms Coordinator, about the possibility of bringing UPATI to your country. We also try our very best to promote the work that UPATI Fellows can do through their experience working not only within their own therapeutic area, but also on a more general level with EPF or other paradigm type projects, so like found under the IMI. We originally had UPATI, now there's Paradigm. There are also other IMI projects out there that periodically look for patient input, and we at EPF have the opportunity to hear about these and do our very best to pass them on as opportunities to you and the already existing UPATI alumni. We do that generally through email, and we also post that periodically in the Facebook group that you should all now have access to, for those of you who are on Facebook, of course. And one of the objectives that we've had as part of one of our latest IMI projects is to have the opportunity to redevelop the UPATI portal, the UPATI toolbox, so to speak, into an overarching area that will also include a dedicated area for the alumni to continue discussions, to continue collaborating, and also to find about opportunities to work together. And I also advise you, on that note, to look out for an email from me probably within the next week. We've actually been approached this morning looking for 5 people to assist with some work on a health data project within EPF, and also collaborating with other partners here in Europe. So watch out for that, more to come. And we hope that we can also count on you to help us run future courses, run future education, but also let us know what you're up to. One of the things we need to do is build a consortium. And building a consortium means that we constantly have to work with existing partners and also expand our consortium to more partners in the future. In order to do that and to constantly show the value that UPATI is providing, that allow us to continue to provide education via the toolbox and via the patient expert training course, we need you to share with us the work you're doing. Contact Tamas, tell us what you're up to, how you're using your training, even if it's in the smallest way that you might think that might be insignificant. It really isn't. We want to hear about it so that we can tell the world about it, tell our partners about it, and also show what you're capable of. And more than anything, other people will see where you're from, what you're doing, and have ideas of how to involve you in future projects. So please do keep contact with us in the future, and we'll continue to survey every 6 months or every year or so and update that valuable impacts flyer that we have available on the UPATI website. And that attests to the skill and the dedication that you have as volunteers and as workers in the field of patient engagement to change the way that patients are involved and represented in Europe. Moving back, I'd now like to congratulate our second round of UPATI Fellows, starting off with Charlotte Norgard from the Lupus Friends and Family Foundation, who will use her training and her daily work to conduct business for the lupus group and make important improvements for other patients. Karoluasi Nwosu from Sickle Cell and Young Stroke Survivors plans to use the UPATI training to work with ethnic minority communities and also the African Caribbean communities in the UK and around the world to help them understand the process in the medicines research and development, and that can open up suitable channels of communication to increase patient involvement and engagement. Alexander Payton from NRAS Arthritis will continue being an actively engaged patient as an individual at every stage in the medicine's R&D process, but also advocating on behalf of the NRAS within the MSK community in Scotland. I thought we talked about using acronyms in the UPATI training course. I hope you understand most of them at this point. And John also is going to continue promoting patient engagement through UPATI and also working with us in Paradigm in the UK and in Europe. That's even after the UK potentially leaves Europe. Margaret Pull from Hepatitis Aid Austria, rare disease is for liver, will help build the UPATI Austrian platform along with other UPATI fellows from previous courses and look to pass on her knowledge to other patient advocates in order to strengthen the patient communities already active in Austria. Sarah Perez from Neurological Diseases and Rare Diseases wants to use the knowledge that she's acquired to improve the quality of life of people through the participation of patients in clinical trials. Nicholas Filippo from the Cyprus Association of Cancer Patients and Friends has used the UPATI training already to establish contacts with other people who make it possible to construct new networks, enabling him to move on to greater and greater things with his work in patient engagement. Martin Poole from Lung Disease wants to reach out and interest more people to become well-trained and involved in medical research in the Netherlands. She hopes to start a Dutch UPATI course soon. And the great news there is there are already a number of other UPATI fellows with exactly that aim who've started the ball rolling, who are going to work together to make that a reality. And as far as I remember, translation has already begun on that Dutch UPATI training course to happen at a national level. Blanca Rubio from Lupus Madrid wants to share what she's learned with those that are interested in becoming active partners in health issues. Nikolina Saleta from the Croatian Melanoma Society will use her knowledge and insights acquired during the course to improve the healthcare systems in Croatia and around Europe. Giora Shaf from the Israeli Myelonous Leukemia Group hopes to bring Upati to Israel and educate other patient advocates. Olivia Scheel, chronic pain and spinal cord injury in Ireland, hopes to use the Education Empowering Upati course to use her voice as a patient in Ireland and in the EU, as she now feels ready to speak and work with all stakeholders. Mitch Silva, from Rheumatic Diseases and Rare Diseases, wants to participate in discussions with regulators and drug producers to incorporate patient insights, as well as to create a group of patient experts to fill the gap in patient voices along with the medicine's R&D. I know Mitch has already started that work through becoming very actively involved in Upati Belgium. Angela Soltan from Cystic Fibrosis Moldova wants to write and give talks about the importance of learning and understanding how to use health systems and how to make them better. Paula Suez Martins from Cystic Fibrosis National Association will continue to make a difference for the cystic fibrosis community in Portugal and in Europe. Tanja Spanik from Europa Donna Slovenia hopes to continue using the knowledge acquired during the course in her future work. Boas Spearman from Multiple Sclerosis hopes to set up a new regenerative medicine research institute in the Netherlands for neurological diseases. Aim big, and we're going to help you get there, and we look forward to collaborating with you on that as well, Boas. Sabine Spitz from Breast Cancer hopes to fulfill her advisory board tasks in clinical trial more effectively now that she knows much better about the processes and how all of the different people around the table come together to finally make a difference for patients in Europe. Eva Christina Stumpe from GGM Initiative and SMA will continue to work as a patient advocate and will do her best to disseminate her new knowledge to her disease community and encourage them to get better educated in R&D of medicines. And I guess Eva brings up a very important point there. You are the few, you are the champions now of patient engagement. You have been awarded the knowledge that Upati is able to offer, but we also recognize that it's a drop in the ocean. We've trained 154 Upati fellows over the last 5 years from a continent with hundreds of thousands of patients. We need you to help us leverage that knowledge by bringing it into your community level, your national level, and your regional level. So whenever there's an opportunity, we hope that you'll also lend your hand to do that. And I know it's always hard, we're always busy, and there's always lots of work to do. So our picking priorities is particularly hard and particularly difficult for all of us. Stavros Terzakis from the Union of Heart Patients of Naval Officers in Greece will use the training to bring meaningful changes for heart patients in the Greek Navy. Nicole Thiele from EFCNI hopes to contribute in fostering the role of informed and responsible patients with their representatives by working face-to-face with academia, clinicians, and bring meaningful improvements to the healthcare system. I guess it's no longer just face-to-face either, we're now also talking about being able to work on an eye-to-eye, the same level with each other, being able to speak the same language and understand each other's processes. I think there's also a little bit of education still to be done by us as Upati, but also by you as now part of the Upati family, to educate our colleagues in academia, the clinicians, also our colleagues in pharma, the regulatory authorities and HTA, in how we can effectively do patient engagement and the value that can be brought from involving patients right from the beginning of research. Mirjami Min from the Association of Cancer Patients in Finland wants to share the information acquired at the Upati course with patients and patient representatives at the national Upati events. She hopes to improve patient involvement in clinical trials and the HTA processes. Ana Valero from the Myoma Patients Europe provides resources and knowledge about almost all different roles patient advocates can have. She hopes to apply them in the best possible way to have the best possible representation in the patient community. Malena Veterli from FMF and autoinflammatory diseases hopes to improve her ability to effectively advocate for patients and become more involved in clinical trials and the planning of medicines development. Samuel Vincent from Alpha Rheumatism hopes to participate in the elaboration of a national strategy dedicated to patient education. Yeah, I see we've got our slides mixed up there. I'm very sorry, Malena. We also recognize you as a UParty Fellow. Now we'll move on to Samuel Vincent from AFLA. He hopes to participate in the elaboration of a national strategy dedicated to patient education in collaboration with UParty France. Hans-Rudi Völker from UParty Switzerland. I must say, my favorite UParty national platform, because it's my home UParty platform and I'm a member there, wants to be an active partner and a national representative in different national bodies and commissions on public healthcare. And Hans-Rudi, I guess a message to you, because you're my favorite ENP, I have very high expectations of you to make sure that the Swiss ENP at least meets what everyone else is doing in Europe, and hopefully will begin to lead the way in the work that we managed to achieve on a national level. And Viadet from UParty Luxembourg hopes to synthesize the patients in Luxembourg to become more empowered and wants to involve more patients in research as well as other groups to improve health systems. And now I'd like to pass the word over to Matthias Gottwald, our other co-chair of the UParty steering group. As you might imagine, UParty is a public-private partnership that means we're equally led by members from industry as well as the public side. So Matthias leads the UParty steering group with Nicola Bedlington. I'd like to pass over to him for a few short words. Go ahead, Matthias.
Dear UParty graduates, I'm Matthias Gottwald from Biopharmaceuticals, co-lead of the UParty program, and together with Nicola Bedlington and a few others, one of the founders of UParty. In the name of all stakeholders behind UParty, I congratulate you very much for your success of finishing the course. I know that this has been a major investment of time and energy for all of you, and I can only express my sincere thanks to all of you for staying committed. The stakeholders behind UParty, namely the pharmaceutical companies, also the regulatory authorities and the HTA authorities, rely on patients like you with the skills that you have acquired. The challenges we face in healthcare need to be jointly addressed, and you can play a major role along the whole phase of medicine's development. A survey among the graduates of the first two UParty courses showed that the course empowered them to play a much more active role, for example, as advisors for pharmaceutical companies in the design of clinical trials, in regulatory advisory committees, but also within their own patient organizations. I wish also you, the graduates of the third UParty course, many opportunities to use your new skills in the joint work on better medicines for the many diseases which still cannot be satisfyingly treated. And I look forward to hopefully meeting some of you also in person in our joint work for better treatments. All the best, take care.
Wishing you all a wonderful congratulations on your graduation.
Congratulations.
Congratulations. You've made it.
Congratulations!
Congratulations, you made it and you're absolutely amazing.
And finally also, a congratulations from me, not just from all of the wonderful people that I get to work with on the UParty management team, but on behalf of everyone in the UParty consortium, the editorial board, the course committee, the steering group, and everyone that we work with as volunteers as part of the training, who's worked very hard to make sure that you have the best possible education we can provide, but also is looking forward to working with you in the future, whether that be at events, and I know I'm already seeing a number of you next week at the DIA meeting in Vienna, but I'm sure I'll be meeting many of the rest of you throughout Europe over the course of the next 12 months and beyond. But it will be great that we can begin to working with you at a national level and at a European level, now that you're also welcomed as part of the wider UParty family. UParty is something that is made up of a group of individuals that come together to become the premier network for patient engagement throughout Europe and throughout the world. Congratulations, Cohort 3. You've done a great job. It's been hard work. And have a fantastic evening.